Hello everyone, and welcome to this presentation on plant-based eating for health and longevity. My name is Vienna Morrill, and I've been working here at Barry Dunn for about 11 years. I've had what has pretty much been a lifelong passion for all things health and wellness, and I'm currently pursuing my master's in applied nutrition at the University of New England. I also have a certificate in plant-based nutrition from eCornell and have attended plant-based culinary school with the Matthew Kenney Culinary Institute, where I focused on preparing meals using only raw ingredients. In fact, many of the images used throughout this presentation are products of that program. I'm also a longstanding member of the firm's wellness committee. Today's presentation will begin with an overview of the current state of health. We'll then talk about the benefits of plant-based eating before diving into some of the specifics of what plant-based eating entails. I'll cover some frequently asked questions and provide tips for incorporating more plants into your diet. I'll leave you with some resources and inspiration, share the references used throughout this presentation, and also allow some time for discussion at the end. So, current state of health. If you watch the news or read the papers, you know that the U.S. spends a lot on healthcare. In 2016, the U.S. spent nearly twice as much on healthcare as other high-income countries, yet had poorer population health outcomes. In one study of these higher-income countries, life expectancy in the U.S. was the lowest at about 79 years. Whereas these other countries had life expectancies of 81 to 84 years. According to the Centers for Disease Control and Prevention, chronic disease accounts for about 75% of our aggregate healthcare spending. So that ends up being over $5,000 per person per year. There are a number of different estimates floating around relating to how change in lifestyle could result in a reduction of chronic disease and how that reduction in chronic disease could substantially reduce healthcare costs. As many of us have experienced either personally or through friends or family members, the cost associated with treating and medicating chronic diseases can really be astronomical. Some medical leaders in the world of plant-based nutrition have suggested that lifestyle change could reduce chronic disease incident, heart disease specifically, up to 75%, which this alone would equate to 30% savings on the U.S. Medicare budget. So what are the leading causes of death in the United States? As you can see, chronic disease makes up the majority, with accidents, influenza, and suicide being the only outliers. Research, which we'll discuss momentarily, consistently demonstrates a dietary link for all the chronic diseases indicated with a red asterisk. It's particularly strong for those, the association between plant-based diets specifically and decreased risk for chronic disease is especially strong for those items bolded. Generally speaking, gainful employment is certainly associated with improved health outcomes. Here at Barry Dunn, employment comes with great health insurance offerings, annual health screenings with financial incentives, yoga, boot camp classes, steps challenges, weight loss competitions, etc. However, there are also challenges associated with being in the workplace that really just can't be ignored. We all know that stress contributes negatively to our mental and physical well-being in a variety of ways. We also know that long hours in the office or at a client often translate into long hours sitting at a computer or meeting table, and that sedentary time, stress, and combine that with poor dietary choices, and you're really introducing a lot of lifestyle factors that increase your risk for obesity and chronic disease. And while the health of the individual is the utmost concern, employee wellness is also a business concern. This is particularly relevant for places like Barry Dunn, who are self-insured And there's direct costs associated with illness and health concerns, but there are also indirect costs. In a survey conducted by PricewaterhouseCoopers, they showed that the indirect costs, like time lost due to illness associated with employees who suffer from chronic diseases, are approximately 4 times the cost associated with healthy employees. Overall, it's been my observation that our employees care about their health. The health nerd in me always gets a little excited when I open the community refrigerator door and see Tupperware containers loaded up with salads and veggies and grains. Our employees' names consistently show up in the results of local races and charity activities as well. However, many of us want to do better, and many of us do not know exactly what better looks like, especially with the deluge of information scattered across the internet and on TV, articles and news outlets saying one diet is better than the next. So today my goal is not necessarily to convince you that you need to adopt a fully plant-based diet, although I totally support you if you do, that's fantastic, but instead to take a step away from diets that demonize fats and carbs, and instead to really look at the overall quality of the foods you eat and make an attempt to simply eat more plants and less animal products. All right, so we're going to talk about some of the health benefits of plant-based eating specifically. Who in the room is familiar with plant-based diets? And does anyone here actually follow a plant-based diet? Okay, great. So many of you are familiar with the concept of plant-based eating, but for those of you who aren't, we're going to talk about the benefits first, but we're going to go into detail on what exactly a plant-based diet entails a little later. But in short, it's a whole food-focused diet that really does not include meat, dairy, or eggs, or animal products. With plants, you get a lot of bang for your buck. The higher nutrient density means that for fewer calories, you get all kinds of micronutrients and antioxidants without the less desirable elements like dietary cholesterol and saturated fats. The benefits of a plant-based diet go further beyond the nutrients. There's also thousands of phytochemicals which provide all kinds of beneficial functions. Neutralizing free radicals, anti-inflammation, reducing cancer activity, enhancing immunity, and so forth. When eating a whole food plant-based diet, you also never have to worry about getting enough fiber, so no more Metamucil. It's estimated that more than 90% of the U.S. population does not get the minimum recommended amount of fiber. Fiber is incredibly important for supporting your gastrointestinal, your cardiovascular, and your immune systems. Plant sterols are cholesterol-like substances that are found in plants. They actually help naturally lower your LDL, or your lousy or bad cholesterol, by getting absorbed in replacement of the LDL cholesterol. So let's start talking about some specific conditions, starting with the #1 killer in the United States, and that's heart disease. While the plant-based diet shines in a number of ways, this is perhaps where it stands out the most. Low-fat vegetarian diets have consistently been shown to prevent and reverse heart disease, particularly when coupled with exercise and stress management. Some studies have conservatively found a 25% reduction in disease risk, while other more aggressive studies, such as the Lifestyle Heart Trial, where patients were put on a true, low-fat, whole-food plant-based diet, they show that they could regress the heart disease in those individuals versus the control group, where the control group was following still a healthy diet, the American Heart Association diet, healthy in the most general sense. But even those individuals on the healthier diet, the heart disease or Heart Association diet, had a worsening of their condition compared to the plant-based. If you are interested in exploring this topic further, there are some really amazing doctors who can provide thought leadership in this field, and I can point you to some fantastic podcasts featuring these individuals. Our next chronic disease is cancer. We've all been touched by cancer in some way, shape, or form. It's scary stuff. It seems like it can happen to anyone. While it's impossible probably to completely eliminate the possibility of encountering a diagnosis, there are definitely things we can do to reduce the chances. Including animal protein of any sort in your diet has been associated with an increased risk for cancer. Specifically, consumption of foods, meat, specifically with insulin, like growth factor 1, has been shown to promote cancer cell growth. Hemiiron, which is animal-based, has also been shown to be pro-inflammatory. And chemical carcinogens that get formed when you cook meat are also pro-inflammatory and promote free radicals and oxidation. Finally, N-glycolinominic acid is yet another compound found in meat that promotes inflammation. Many people will say, I eat meat, but I source my meat very carefully, buying only grass-fed, organic, humanely raised beef, for example. While I would agree that this is preferable to factory farm beef for a variety of reasons that extend beyond health, the reality is that the risks we just discussed, not a single one is avoided by carefully sourcing your meat purchases. Yes, you can avoid antibiotics and antibiotic-resistant bacteria, but pretty much everything else is inherent to meat in its most natural state. The body of evidence supporting the association between cancer and meat and dairy consumption is so strong that the American Cancer Society is now recommending survivors follow a primarily plant-based diet, and research is particularly strong for breast, colon, prostate, and skin cancers. There's also a large body of scientific research supporting plant-based diet for type 2 diabetes, both population studies, which look at the dietary patterns of an existing population and compare rates of disease, and intervention studies where participants are randomized, variables are controlled, and interventions are introduced, have found that plant-based diet is associated with improved blood sugar control, improved insulin sensitivity, and improved release of gastrointestinal hormones, which help regulate food intake and control insulin secretion. Over 2/3 of American adults are overweight or obese. Overweight and obesity are associated with higher all-cause mortality. When you couple higher body weight with other risk factors, such as the ones listed on this slide, you have what is referred to as metabolic syndrome. If you have metabolic syndrome, you may already have or be at greater risk for many of the other chronic conditions we've discussed throughout this presentation. With the exception of waist circumference, these are all data points collected and used during our annual health screening and can be easily tracked. If you're looking to reduce any of these factors, a plant-based diet can be an effective holistic approach for doing so. Reducing these factors has been associated with a 50% decreased risk for metabolic syndrome. Antibiotics are used in livestock to promote growth and prevent infection. In fact, 70 to 80% of the antibiotic use in the United States is linked to livestock animals. The antibiotics used in food-producing animals kill or suppress susceptible bacteria, allowing antibiotic-resistant bacteria to thrive and get passed on to consumers through the food supply. Consumers can then become ill from the resistant bacteria, and of course, the resistant nature of the bacteria makes the illness difficult to treat. In 2014, the World Health Organization warned that the antibiotic resistance crisis is dire. It's a public health concern. Each year in the U.S., approximately 2 million people are infected, and about 23,000 of these will actually die as a result of the infections. So scary stuff. So we've talked about the many benefits of health-related reasons for switching to or towards a plant-based diet, but let's talk about what a plant-based diet is and what it isn't. Plant-based diet focuses on eating plentiful amounts of whole, nutrient-dense foods. You have less of a focus on calorie and macronutrient counting. You're really focusing on just maximizing your health benefits per calorie while minimizing harmful exposures. You're avoiding or limiting foods derived from animal sources, meat, eggs, dairy, limiting sugars and salt, avoiding processed foods. So foods that are made up of other foods that have been refined from their whole form. This graphic can help you picture the building blocks of a plant-based plate. You may be familiar with the USDA's MyPlate, which is basically the most updated version of the food pyramid. And while, there's plenty of good things about MyPlate, I find this rendition of the plate from Harvard to be more progressive, more objective, less industry influenced, better aligned with current research. The Harvard plate really emphasizes a plant-based diet with allowing the option for some limited meat and some limited dairy. It's a very simple yet helpful resource.